Welcome to the seventh session of the Healthy Heart, Healthy Life Pune series regarding the health of our heart. I am Dr. Neelkant Karandikar, Chief Cardiologist at the Heart Clinic in Mukund Nagar, Alpha Diagnostics Tilak Road, where I do non-invasive procedures like echo and stress test, etc. I'm interventional cardiologist at the Ruby Hall Clinic and other hospitals where I do angiography, angioplasty, etc. I'm the honorary professor emeritus in cardiology at the BJ Government Medical College and Sassoon Hospitals. Professor emeritus, that is lifetime professor at this place. And I'm the first gold medalist of the Bombay University, Mumbai University now. I've delivered several lectures in India and abroad, including Paris, Barcelona, Spain, Cairo, etc. Today we are going to start discuss a very interesting topic called multifaceted angina, or the different phases of angina. In fact, in the 71st Annual Conference of Cardiological Society of India in 2019, held in Delhi, I delivered this lecture on multifaceted angina, challenges in management. And this is a very big conference, in fact, an international conference, we could call it. We have seen earlier what is stable angina. Stable angina is the most common type of angina, which usually comes as chest pain or chest discomfort. It usually happens during physical activities such as walking uphill or in cold weather or after meals. The pain goes away with rest or angina medicine like nitroglycerin. It is predictable and often feels similar to past episodes of chest pain. So, suppose it was coming in the center of the chest, it will keep on recurring in the center of the chest. The chest pain usually lasts a short time, 2 to 5 minutes or less, 2 to 5 minutes. It can extend up to even 20 minutes in severe cases, but more than that, one should suspect a heart attack. We know very well that stable angina is precipitated by exercise like walking and emotional stress. One of my patients was reported to me that she was seeing that TV serial at that time, Hamida Bai Chikoti, and became very emotional and started getting chest pain. So this is the typical picture of a senior person getting chest pain, and he has a tightness or pain in the chest, and he has a blocked coronary artery in his heart. Now, this multifaceted angina reminds me of the 9 roles played by the highly talented actor Sanjeev Kumar in that Naya Din Nayi Raat movie. And this multifaceted angina also comes on in different ways, plays different roles, as we will see. Quickly looking at the unusual presentations of angina, it is important to note if discomfort or pain is noted in any part of the body on exertion or emotional stress. This is important. On exertion or emotional stress, the parts usually affected being neck and jaw, shoulder, upper abdomen, and back. Then this could be a type of angina. We have seen earlier that usually the anginal pain comes in the center of the chest, but it can go to the neck and the jaw, the left or the right shoulder, inside of the arm, more commonly left than right. The most confusing part of angina is this location, lower chest and upper abdomen, this location. It could be cardiac pain, typical angina, or it could be muscular pain, which usually increases with body movement like this, or if you move the chest, then the pain increases. You stop the movement, the pain would reduce. And it could be because of gases or flatulence, where the pain is in the same area, but may get relieved with antacid liquid or tablets and after, belching. I remember the story of a patient who developed pain in this area, discomfort. He thought it was because of gases, and he took some antacid liquid and went to sleep. He said after 2 hours sleep, the acidity will go down. When he woke up, the pain was discomfort was still there. So he thought that the gases are not coming out. So he went for a swim. He owned a swimming pool, and in spite of that, the pain or discomfort did not get relieved. Then he came to the hospital, and we saw that on ECG he had severe ischemia of the heart. That is, he had severe angina. So this area, sometimes even the doctors get confused, and it is better to get properly checked if there is a pain in this area. The second type of angina is called variant or principal angina because the cause is basically different. In the Heberden's angina, which we discussed, the typical stable angina, there is a block because of atherosclerosis. But in the variant angina, there is a spasm of the coronary artery supplying blood to the heart. Spasm means the artery undergoes contraction. And this could be because of some environmental pollution, emotional stress, maybe sometimes, or smoking, or various causes. So, in variant angina, this is called in the spasm in the heart arteries. There is severe chest pain, often at rest and at night, may improve with angina medicine. So this kind of pain, can also occur when you're lying down, maybe even at rest. And if it is a typical like angina, what we have described, we should suspect that it is a variety of angina called variant angina. Other symptoms of angina can occur with exertion or emotion, and they are called as angina equivalent, because though they are equivalent to angina, and these are general fatigue, breathlessness on exertion. There is no chest pain, but these two are there, or diaphoresis or excessive sweating, then dizziness or syncope, unexplained nausea or vomiting. So you will say now, Dr. Karandikar, you're making things very confusing. But remember, overall, if any symptoms comes on with exertion or emotional stress, keep your suspicion alive and think whether this could be angina. What is second wind angina? Look at the various phases of angina now. Angina occurs after starting exertion, but after some time it passes away, and the person continues the physical activity like walking. Suppose a person went for a walk. After walking for 2 kilometers, he develops chest discomfort, but he's a brave man. He says, no, I will continue to walk. I have been prescribed long walks. Actually, a wrong decision. If you get chest pain, you should stop and then consult a doctor. But this fellow, if he continues, in some cases, the pain may even go away. Now, why does that happen? Now look, there is a block in this artery. When the person starts walking, there is more demand of blood on the heart. The heart pump starts pumping harder. And then this area shown in, this dark shade becomes devoid of blood or gets less blood, and there is angina. But there are, always compensatory mechanisms given by our creator. This is the left coronary artery showing a block, and the right coronary artery has no blocks. And branches from the right coronary artery are, in such cases, they get connected to the left coronary artery. And as the demand of the left side increases, these collaterals dilate and supply more blood to this area. And ischemic area has come down, and the chest pain also comes down. This is called second wind angina. Angina, as we have already seen, can occur in the abdomen. It can occur in the teeth. Here, let me tell you another story. A dentist brought his mother to me saying that she is getting pained while chewing, eating. I asked him, what about her teeth? Are they all right? She said, Doctor, I have checked the teeth. Absolutely fine. There is no problem with the teeth. I want your opinion. I want a general checkup of my mother. So when I took the ECG, it was normal. Then I started suspecting something, being a cardiologist maybe, that this pain which is coming on in the after chewing, here the exertion is in the form of chewing, and the pain is also coming on in the jaw. So I did a stress test for her, about which we'll talk in one of the later sessions, and it was positive, showing ischemia. This lady underwent an angiography. She had a block, and after angioplasty, her pain on mastication or chewing stopped. So, this is another phase of angina. Angina can be on micturition also. You go to pass urine and you get pain in the chest. This could be angina. Angina decubitus. When you lie down and you get pain, it is called angina decubitus. There is also a pain called coital angina, that chest pain develops during sex, and it goes off after the sexual activity, and that is called as coital angina, another phase of angina. One very important thing about all these phases of angina is that there is no consistent correlation between the severity of symptoms and severity of heart disease. No consistent correlation. What I mean to say, some people, especially elderly and diabetics, may develop very mild chest pain and may have severe heart disease, severe blocks in their coronary arteries. Whereas somebody who is getting very severe chest pain may or may not have severe disease. So you cannot correlate, like when we say fever is rising, 99, 100 is mild fever, 102, moderate, 104, 5 severe, and then we rush to the hospital. With the heart symptoms, it is not like that. The symptoms do not necessarily correlate with the severity of heart disease. And let us see what the final thing. Silent ischemia. Very common, especially in elderly and those having diabetes. Most episodes of angina are silent than painful ischemia in the same patient, and it is difficult to diagnose. Any person with multiple risk factors should be investigated for heart disease. And this is the probably the second last slide. And what I want to stress is angina pectoris, or the symptoms of heart disease. All the other symptoms which you discussed may not come at all, even if there is serious blockages. There are serious blockages in the blood flow to the heart. And that is why I have already said here in the third sentence, any person with multiple risk factors like smoking, obesity, high body weight, hypertension, diabetes should be investigated for heart disease. Detecting heart disease investigations are therefore of paramount importance, and we will be discussing about these investigations in detail in subsequent sessions. So thank you very much for attending this session, and the viewership, I think, is growing, and I would urge you to subscribe to my channel if you have not already subscribed. Give me a like, and also share the channel address with your friends. Thank you very much. Thank you. Again, thank you for attending this session, and do come next time also. And I assure you we'll have a very informative and interesting session even next time. Thank you.